Hi. I would like to start off by thanking you all on behalf of the Milwaukee Public Library for attending today's presentation. I would like to go over a few things before introducing our presenter. To stay in touch with all programs being offered with the Milwaukee Public Library, please visit mpl.org/stay-connected and follow MPL on social media to stay updated on all our programs and services. If there are any questions that you have for Dr. Thrasher, please enter the questions into the chat box and we will get to them at the end of the presentation if there's time. Please remember to mute your mics and switch your cameras to who's talking. That way you can see the presenter as the primary speaker. This webinar will be recorded and put on our YouTube channel. I'll go ahead and introduce our presenter now. Dr. Tony Thrasher is a board-certified psychiatrist with 16 years experience. He currently is the president-elect of the American Association for Emergency Psychiatry. He is the Milwaukee chapter president of the Wisconsin Psychiatric Association and clinical associate professor at the Medical College of Wisconsin. Dr. Thrasher, would you like to add anything?
No, you've covered it. Thank you.
Okay.
Once again, thank you guys so much for having me. Time is precious, and I really appreciate the time spent on just trying to educate oneself on the issues surrounding the pandemic, and that you are willing to talk with me and look at some of just not the physical health components of this, but also some of the mental health components of this. And I'm very, very thankful to have your time today. We've got some slides in front of us. I think they will probably take us the majority of the hour, but I've got the chat box open. This screen allows me to multitask. And so hopefully if you have questions, feel free to let them fly. If I end up waiting till the end, it's probably just because they fit better at the end. Otherwise, I can try to answer the questions as we kind of go through it slide by slide. As mentioned today, we are going to really focus on what it means to be in a pandemic, which we are, and what it means to acclimate to it or re-acclimate to kind of this new world that we're dealing with. Given that I think most people would agree, this is more likely to be more long-lasting than it is short-lasting, as has already been seen. I don't want to depress people, but if you think back to March when people were talking about this being done by April or May, I think it's proven how powerful a pandemic can carry on, and we're going to talk about some of that. This is my contact information, and as you guys know, you will have access to these slides. I always include this because sometimes the talk itself can have a lot of things going on, and maybe you don't have time to think of a question and you want to reach out afterwards. Maybe you have a really great question and you just don't want to offer it in front of other people that are on the phone. I understand that completely. You can reach out to me afterwards. And then lastly, if you're like me, I think of all my best questions 2 or 3 days later, once the person is not directly in front of me. So if any of those things come up, I like to give you my contact information. Usually email is the best bet. I'm on that fairly regularly, and you're more than welcome to reach out to me, and I'll do my best to answer your question. And if by some chance I don't have the answer to your question, then I will try to track down who would. I think, pardon me, it's always good practice to note disclosures. I have no significant financial disclosures for you. I don't sit on a speakers panel. I don't own stocks in pharmaceuticals. I don't do anything that is tied to industry per se. My only income is as a Milwaukee County employee. I have several national and state disclosures that I give you there, but those are uncompensated. They are organizational disclosures, but they are not financial disclosures. All right, so where are we going to start? I think whenever you're talking about something like this, given that the last time our country had a pandemic, the majority of us would not have been alive unless we were 102 years old. I think it's good to kind of look at some history. And the history is hopefully meant to give us some hope that people have been through this before and have done well. And in fact, sometimes have come out changed in some ways for the better on the opposite end of the pandemic. Let's look at some of these. We'll talk about a historical look at pandemics. We'll look at how COVID-19 is affecting all of us, no matter where you may work. I would also act it affects you not only as a person, but also in your family role, whether that be husband, wife, father, mother, son, daughter, etc. It also affects you as a professional with your employment and what you do as a frontline service employee. And then lastly, I'll kind of turn in the last 20 minutes to talk about some healthy ways to handle this, both short term and over the long term. Now, whenever I talk about COVID-19, I like to use what are called the stages of grief. And typically, these are things you may have heard of. They're a fairly popular term that usually refers to stages that a lot of people, not all people, go through during times of grief. They tend to go through a period of denial, then being angry about it, then bargaining around it, then getting sad, and then eventually accepting it. Once again, this isn't pertinent to all grieving stages, but it is seen in a predominance. And I'm seeing it myself with a lot of people concerning COVID-19. So for instance, right off the bat, what you saw in March and April was, well, it's not really a problem. I'm sad to say, as a medical professional and a scientist, I still see some people who say this is not a problem. I would like to say I think most groups are all saying this is clearly an issue. This illness has affected all of us in ways that no other illness has during our lifetime. And then after denial comes anger, what it means to have it around. I have small children, and at least once a week, one of them will turn to me and say, deadpan, you know, having this COVID-19 here really sucks. And I'll say, you summarize that pretty well. I think that's a natural emotion to have. Then we get into the bargaining stage, which not everybody does, but some people do, where they try to kind of rationalize or hope that it's not as bad as we think it is, and maybe it's going away, and I can just kind of ignore it and somebody else will take care of it for me. That obviously does not work. I would argue that's why Wisconsin is kind of in its second stage of where we are now. And then eventually comes depression and acceptance. And hopefully most of this talk is geared more towards stage 5, assuming that we acknowledge there is an issue, it's affecting all of us, and as angry and as sad as that may make us, there are some positive things to do. So let's get started with some of the historical information. So once again, what's interesting about this is it's made us look at our past. And we have had pandemics all over the globe in the past. Some of these you may have heard of. The one that gets all the publicity is the influenza epidemic of 1918, because it was the most recent one in the United States about 102 years ago. Yellow fever in the early 1800s. If you want to go all the way back to the 1300s, was the Black Death, or what was known as the bubonic plague. And I would even argue probably North America's first big pandemic is when our European ancestry first moved here with Columbus and others, is a host of illnesses were brought over that did not exist in North America at the time and had significant effects on the Native American population, which had a lot of changes, the majority of which were not positive. This is a great article I like to talk about. This speaks to the original pandemic of 1918, and it's entitled Pandemics Leave Us Forever Altered. And what was noted is from 1918 till about 1950, nobody really talked about this much, till formal science started doing more research and journals and looking at that pandemic. What they found was a lot happened after the pandemic of 1918. You started seeing more medical problems. You were seeing lower birth weight in babies. And you were seeing something that is very common with most pandemics. It's what's known as a U-shaped mortality. And by that means, if you think of kind of the shape of the letter U, at each end is where the mortality is the highest, the very young and the very old. And that is one of the most pertinent things about pandemics, is it sometimes, if it's a large enough pandemic, it knocks out a large part of the future population and a lot of the historical population, which is so important as we try to learn from the people that have been there before us. Now, I'd also like to point out some really interesting things have happened with pandemics. In other words, even though they are incredibly difficult during the time that they exist, a lot of cultures after a pandemic or after a large-scale disaster have had significant improvements. Some of that was on purpose, and some of that was, I would just say, fortune, chance, and good nature. So I'm just going to mention a couple here. If you look at the Peloponnesian War, which was a really long time ago, basically Athens would not have lost that if it wasn't for typhoid that decimated their entire forces. That changed the entire geographical outlook of Europe. I mentioned to you earlier the Black Death, and to give you an idea there, during the time of those 3 to 4 years, 60% of the world's population died. If you can imagine, as bad as we're in now, that would be even worse. And some really interesting things came out of the plague back in the 1300s. You started to see formal hospitals get built that focused on safety. They started developing quarantine protocols. The very idea of public health first happened. Back in the day, surgeries were not as sterile as they are now, and this definitely helped with all that. And then purely in a civil rights standpoint, this ended what was known as feudalism. back in the day of lords and ladies and basically having, I would say, pseudo-slavery on one's campus, where you would pay for a part of the lord's land and then work the land and contribute your crops to that person. That basically went away with this, because most people that were in positions of power, when you lose 60% of the global population, you lost a lot of the people that were being loyal to you or were being forced to work for you. Speaking to our geography, many of you are familiar with the Louisiana Purchase. And the joke behind that is always that the United States government, Thomas Jefferson in particular, negotiated that purchase for very low cost, and it got a lot of land for it. Part of that was because at the time, the French did not have the manpower to still hold down that foreign territory. Yellow fever had come through in a relatively good pandemic. A large percentage of the French military were lost. They had already lost Haiti, and at the time, the country and the government decided they did not want to maintain that military presence in North America, and sold the majority of it to the US for very low cost. And then, as I mentioned earlier, the one we think of the most, which is the Spanish flu of 1918, or the influenza of 1918. You saw almost 700,000 Americans die from this. And it is kind of, this is a deeper dive. You did see a lot of changes in epidemiology, which was a burgeoning field at the time. But there are a lot of historians that feel this played a large role in how World War I indirectly led to World War II. And I don't mean to be too much of a history nerd here, but at the end of World War I, as much as it was a world war, everybody had kind of gotten together, they had cleaned the slate, and everybody thought it was going to be kind of a clean break. However, with the influenza epidemic going through the United States, much of the North American contingency was not present at the Treaty of Versailles. And a lot of the North American contingency were the people that were seeking a more moderate resolution to the end of the war. With them not being present, and it being predominantly a European contingency, there was a lot of things that came out of that treaty that perhaps Germany found to be a bit harsh. And that has been directly related to a lot of the rise of the Nazi Party in Germany, was feeling about reparations and how World War I ended, how they were villainized and vilified, which may have been appropriate, but they saw it in a negative light, and shortly thereafter, we had World War II. And then lastly, let me talk about some stuff that I think will speak to us as an American population as well. We have seen a lot of big cities go through significant trauma, terror, and losses, and then bounce back with some really interesting innovations. And this comes out of the Atlantic as well, just poking out kind of some of these areas, like with the New York fire in the early 1800s. One reason that was so important was what they found was it was a very small fire, but it burnt because they did not have enough water to put it out. And so quickly you saw aqueducts start to get made, because the idea was we don't want a fire like that again. Similarly, with cholera over in the United Kingdom back in the 1800s, that led to better sanitation and sewage scenarios. And then the very famous Mrs. O'Leary and her cow in the 1870s Chicago fire, if you think about that, it burned down 20,000 buildings. Massive fire, and one of the things they found behind that was because most of their buildings were low to the ground, easily affected by wind, and were made of predominantly wood and other flammable materials. This was one of the main impetuses to start making tall, very strong steel buildings that, albeit more costly, really gave rise to the skyscrapers and the idea of the great urban city. So you can all exhale. That's the end of my history, but I just like to kind of benchmark us in an idea that, as difficult as this may be, I hope sometime during our generations, we can see how we have hopefully made the best of this and come out on the other side, not necessarily always better, but hopefully better in some areas. Now, what does it mean for us right now? I call this the obvious slide, but I think it's good that we kind of name what we're talking about. So what does this mean for the US? Well, anytime you're dealing with a pandemic, you're going to have issues with family and relationships. Additionally, people are more isolated and frustrated. And with isolation comes the feeling like you have a loss of community, which could also be community in your workforce as well, right? If you're used to seeing people every day at work, they are part of a work family. And if all of a sudden you are separated and pulled apart, that makes it very difficult. I've noticed, at least in the medical field, a lot of irritability and feelings of loneliness and despair when you look at how others have handled the pandemic. And my idea for today is not to get into a he said, she said debate or to cast people as villains. That's not going to be helpful. But I think it is fair to say that there are several people that get frustrated and irritated when they see certain populations perhaps not following recommendations or certain populations ignoring recommendations. Maladaptive coping is my nice way of saying that people are finding a way to get by one way or the other, but that may involve things that are not so helpful, as we have seen rises of substance abuse and alcohol as well. And then lastly, which we'll get to more at the end, is meaningfulness, the idea that what I do matters. It's an important part of every human being, and it means something different for every human being. And in this particular case, going through a pandemic can really affect that. A couple articles here for you, and once again, I'm just trying to give you an idea of what we can say professionally has been happening during the pandemic. These aren't just my thoughts or kind of what's happening in Milwaukee. It's a much larger look at things. And what this particular journal looked at, which is the Journal of the American Medical Association, was they looked at what about healthcare professionals. And I would argue that even though this was about healthcare professionals, you could title this any frontline service employee, including yourselves. Anybody that works with people on a regular basis, how do you handle the anxiety that happens with a pandemic? And what they found was there were very common themes whenever they did these particular surveys. People want to feel heard, people want to feel protected, prepared, supported, and cared for. Seems fairly obvious, but if you think about it, pre-pandemic, these would not necessarily always have been things that you would ask of your employer or ask of the organizations that you work for. This is a different feel from people now as they realize perhaps me going to work is markedly the most dangerous part of my life as opposed to staying home, particularly when other people may be staying home and we wish that we could but can't because of what our profession may be. There's also been a lot of talk about the millennial pandemic is what this has been called. I know that word has a lot of emotion. Some of it is pejorative. I just say it because it's the title of the article, and to be fair, it describes a certain generation. And what they find is of that particular generation, we're seeing a higher percentage of cases, not necessarily with a lot of medical outcomes, but a lot of high positive diagnoses. And there has been shown more of a resistance to social distancing, a lot of worries for parents. You've seen a higher degree of super spreader events, which as the science on COVID is starting to evolve, that is becoming very clear that unlike the flu and some other viruses, this particular issue is spreading much more when it comes to large events. So that is something you're going to hear probably more and more about, is not just being out with other people socially, but how big is the gathering at which you are out. And that there's also a very unique type of contagiousness to this that we have not seen in other viruses. And then also, we have some disparities with this virus. Now, can't say this is purely due to COVID. I think this could be due to some of the structural racism and other things that have been present in our country for a long period of time. But this came out of the New Yorker, and it was called the Black Plague. And this is a great quote that you hear all the time in the community, but I don't think anybody knows who said it first. That's why I call it unattributed. When white America gets a cold, Black America gets pneumonia. And we're seeing that with this particular illness. Similar populations in all respects, but the population that is white compared to the population that is Black, we are seeing very higher degree of severity amongst the Black population. You're seeing it more with hospitalizations, higher degree of morbidity, which means how sick you get, and higher amount of mortality, meaning what is the percentage of people that actually die from the coronavirus. And there's some ethics here too. Probably that's a little bit more on my side of the street than yours as a healthcare provider. We're dealing a bit more with some of these ethical discussions on who gets the care, who are considered essential, where does the funding for treatment go. I think you're going to see this come up in two places. One, I think it was actually the front page of the Journal Sentinel, either today or yesterday, where they were talking about that the hospitals are nearing kind of where New York was back in April. Which is they're starting to run out of space to put people who are sick. And who is going to get what care and who is going to get what bed is going to be an ethical issue. I also think we're going to see this once the vaccines come out. I do believe vaccines will come out. No, I don't know when. But eventually you're going to have this first wave of there's only so many available. Where do we prioritize the vaccines to? And so this is going to lead to some really complex questions, which then again leads back to all those feelings I was talking about on the colorful slide. Now, in addition to kind of looking at this in a statistical sense, I think we also have to call out that during the pandemic, there's been a rise in a lot of serious manifestations of mental illness. We are seeing depression and anxiety are the two big ones, that there have been clear diagnostic increases since March of 2020. We're also seeing more self-harming acts, people who cut or harm themselves in other ways to handle emotion. We're also seeing more completed suicides. Now, to be fair, the rate of suicide across the country has been going up for the past decade, but now that particular rise got even a bit steeper during the time of COVID-19. And as mentioned, we are seeing more addictive issues. We're also seeing more issues of fear with people acting out in a violent way because they feel they have to protect them from either real or not real. And then lastly, some slides I'm going to go over with you guys as well pertain to what it means to be emotionally exhausted and or burnt out. Now, I think we hear the term burnout a bunch. I would also say in the past 3 to 5 years, it's been a hot button word. So I think it's been a very common thing that no matter what type of employment you have, this is kind of something that was around the water cooler. Your administration and your leadership was being educated on it. And then there's probably been some stuff that has been disseminated down to the line staff too. But I want to take a quick look at it because in my work with a wide variety of patients across the city and a wide variety of people across the city, I tend to see this as being one of the more common things we see during the pandemic. And there's 3 big pieces towards somebody actually being suffering from burnout. One is being emotionally exhausted. Now, I always joke that is not sufficient to be burnt out. Otherwise, every parent I've ever met would be burnt out because emotional exhaustion, I think, is part of child rearing as well. But being emotionally exhausted, feeling like you have nothing else to give is a big thing. Number 2 is the one that I think your coworkers notice the most. This is depersonalization. This is where people that would normally be social and connected with a group are no longer such connected. You may notice it when certain people don't go out with the rest of the team after work hours are closed, or don't show up at the birthday party where everybody goes. These type of things are important to keep an eye on, because as people start to isolate and remove themselves from community, burnout is much more prevalent, as is many of those other things I mentioned on the previous slide. Then lastly, usually the last step is when people start to lose their feeling of meaningfulness. They start to lose sense of what I do matters. And what I find is human beings are amazingly resilient people. And as long as there's a hope at the end of the tunnel, or there's a belief that you can have meaning in what you're doing is making a difference for somebody, no matter how small, people tend to keep on going and are pretty successful at it. However, once you start to lose sense of meaning with your work, that's a different scenario. And I share a quote here. Feel free to substitute the word physicians for frontline workers. I just included this from a medical journal, so it says physicians. But let me read it to you, because I think you'll hear some of yourselves maybe in this too. When it comes to stress and burnout, physicians are either too busy to notice it's happening, too stoic to admit it's happening, feel that they can handle it themselves, and or are reluctant to seek outside help for fear of looking weak, worries that people won't think you're competent, or worries that the issues you have won't stay private and or confidential. I see this in all professions, not just in physicians. I've had parents come talk to me and say, I'm scared to death, but I don't want to talk to my kids about it because I don't want to frighten them. I don't want to bring it up at the dinner table because I don't have the answers, and I don't want the other people at the dinner table to know that I don't have the answers. I think this is a really important quote to kind of keep in the back of your mind as we move into the next part of the talk, because part of this is admitting when you need assistance, which, by the way, the majority of us dealing with this pandemic do. There really aren't a lot of hard and firm answers. And as such, there is uncertainty, there is anxiety, there is fear. You're not weak to feel those emotions. You're a human being. The question is, what do we do with those emotions? That's the part that will determine whether we're successful in all this or not. Now, who does burnout typically affect when you're dealing with stress like a pandemic? Individuals that tend to be perfectionistic, type A, hard workers, over-involved, and empathic. If we were having this conversation in person, this is when I would start to see some of you start to smile and shuffle in your seat, because you would know who I'm talking about. And this is a very interesting thing if you think about it. These are exactly the type of people that we don't want to lose in the workforce. These are often some of your best workers. These are the hardest working people. These are the people that may have ascended into leadership positions in your organization, but they are the ones most likely to be affected by some of these stressors. So, all that being said, how do you know if it's happening? Well, it's not straightforward. I think for some people it's very simple to know when somebody is having a hard time during the pandemic. Other times you have to kind of get somebody else to point it out for you. I think you tend to see personality changes, people acting different than they ever have, people that you've known forever who are dramatically different, people that are feeling out of control, co-workers noticing a change in how they interact with each other, people that are less efficient, still showing up but not quite getting the same work done that they used to, falling behind in duties, increased sick calls. I would also note, this was a poll I took of a clinic I used to work at, and these are quotes that people would say. I'm exhausted. I dread going to work. I say hi to my clients, but there's no interest there. Am I really helping people? That's where you're getting into meaningfulness. I feel like I'm working on something, but it has no meaning. It doesn't matter. These are the type of phrases that can really give you insights into how somebody is struggling. These are the type of people we want to reach out to. These are the type of people we want to support. We want to support each other as we're going through this. Now,